What prompted you to give this testimony today? First of all, I want to express my thanks to you because I am very happy with the result. Also, to be able to help other people solve their problems. How old were you when the erectile dysfunction started? I have always been very active in that regard, definitely. I am 70 years old and I had noticed a slight decline in energy around the age of 55. It tended to progress until I was 60 to 65 years old. And then I had serious problems. When you discovered these erectile problems, were the erections of good quality in the morning? No, actually, they even tended to disappear. That's what fascinated me. It's not very easy to talk about this kind of subject. I finally made up my mind, especially since my wife was starting to have serious doubts knowing my temperament. She was convinced I was actually having an affair, so I had to confess to her what was happening to me. It's not very easy to announce. Did telling her that you had this erectile problem reassure her? At first, I think yes. You told me that your primary care doctor, when you actually had a consultation with him, said that it was all really in your head. You underwent tests to find out what was causing the problem. Was it complicated? I was hesitant since I'm a coward. It went well, and I didn't feel anything. The operation when you woke up? It came back little by little, and within a month, everything was perfectly functional. And so, 3 months after the operation, you had another ultrasound of the penis as planned, which showed that there was no leakage, as expected, and the results were clear. Was it easy to resume your sex life? I always had a little apprehension each time. I mostly said, don't try to think that it will go badly. You have the choice between a venous implant. I preferred for it to come back naturally. Do you think that at 70 years old, erections and sexual life are something important? Sometimes it really helps to reconcile in certain situations. We still have enjoyment. What would you like to say to men who are in the situation you were in before the operation? So I think you shouldn't hesitate. Consult. Don't be afraid. I really thank you because it is very important for men to know first that this type of disease exists, venous leaks. It is a disease in which the blood enters the penis well, but it exits too early, which means that the pressure cannot rise. So there is no rigidity of erections. You have explained it very well. Thank you.